We are right on the edge of one of the biggest shakeups in modern medicine, and it's all about artificial intelligence. So, in this explainer, we're going to explore a pretty stunning vision for the future, but also ground it in what's already happening today. And of course, we'll tackle the big questions that come with a technology this powerful. So, let's just start with a thought experiment. What if you had a personal AI, kind of like a digital partner, that was managing your health around the clock, 24/7? I know, it sounds a little bit like science fiction, right? But this idea, well, it's getting closer to reality every single day. To really get a grip on the scale of this change, just listen to this comparison. AI in healthcare is being put on the same level as the revolutions brought on by steel and electricity. So we're not talking about some minor software update here. We're talking about a fundamental shift, something with the power to totally rebuild how we do things. That's the potential we're looking at. Okay, so first, let's paint that picture. Let's jump forward maybe 10 years into the future and see what an AI-driven healthcare system might actually feel like, both for you as a patient and for the hospitals themselves. So first, imagine having your very own personal health avatar. And no, this isn't just another app on your phone. Think of it as a visible alter ego that's with you all the time. It's constantly tracking your health data, telling you what to eat for breakfast based on your numbers from that morning, and guiding your daily choices. It's a completely different way to think about personal health, always working for you. Now, here's where it gets really interesting, how this changes the hospital itself. The vision is for what's called a predictive hospital, an AI system that knows who's coming in before they even walk through the door. The AI handles the diagnostics, the tedious documentation, even helps plan surgeries. And get this, with so-called digital wards using remote monitoring, a lot of advanced care could actually move from the hospital right into your own home. Okay, I'll admit, that's a fascinating, maybe even a little bit of an intimidating vision of what's to come. But it brings up the most important question of all. How much of this is just a futuristic dream? And what's actually happening in hospitals right now, today? So let's bring this all back down to earth, because the AI revolution isn't some far-off thing we have to wait for. It's already here, working behind the scenes in some incredibly important ways. The key thing to realize is that AI is already acting as a super powerful assistant for doctors. I mean, in radiology, it's spotting tiny tumors on scans that are incredibly hard for the human eye to catch. In pathology, it's analyzing test results and suggesting what the diagnosis might be. It's even been used to predict life-threatening emergencies like sepsis. And this last one might be the biggest game changer for doctors. It can just listen to them talk and automatically create the patient record, freeing them up from hours and hours of paperwork. And hey, these aren't just theories. These are actual programs being used today. You've got things like AI Blot, which helps detect strokes and fractures from scans. There's Nest, which does that amazing voice-to-text note-taking. And Epic AI is helping hospitals actually cut down on infections. This just is happening right now. Of course, it's never that simple, is it? A technology this powerful doesn't just show up without bringing some serious challenges along with it. So, let's take a balanced look at the huge benefits AI offers, but also the very real problems we need to figure out. The benefits, well, they're incredibly compelling. They touch on everything from better clinical results to just running a hospital more smoothly. We're talking about much higher accuracy in diagnoses, way more efficiency, which can lower costs, and this is a huge one, less burnout for doctors. It can even act like a double check system, helping to catch and reduce human error. But, and this is a big but, on the other side of that coin, you've got the challenges. For every amazing promise, like higher accuracy, there's a problem we have to solve, like data privacy. For every efficiency gain, there's a hurdle like algorithmic bias. And maybe the biggest one of all, how do we get people to actually trust and accept these new tools? Let's dig into that one for a second, because it's a really critical technical problem, algorithmic bias. So what is it? Well, it's basically the risk that an AI, which learns from historical data, accidentally learns our human biases too, and it might even amplify them. So for example, if a certain group of people has been underrepresented in medical research in the past, an AI trained on that data might not be as accurate for them. Making sure the data is fair and the algorithms are balanced, that isn't just a nice idea, it's absolutely essential for this to work for everyone. And all this brings us to a final and honestly a crucial point. What is the actual goal here? It's not just about cool tech for the sake of cool tech. It's really about how these incredibly powerful tools can better serve our own humanity. This quote just nails it. The real goal isn't to replace doctors or nurses or any other healthcare professionals. The true aim is to empower them, to give them a tool that can handle all the repetitive data crunching tasks so they can focus on what only a human can do. And this is the real payoff. This is the whole point. By automating diagnoses and getting rid of tons of paperwork, AI gives doctors back their most precious resource, time. Time to actually talk to patients. Time for empathy. Time for that human connection and communication that is at the very heart of healing. So, the optimistic vision for the future, the one we should be aiming for, is one where our hospitals become both smarter and more human. Yeah, they're data-driven, they're predictive, they offer incredibly personalized care. But the human connection isn't lost in all that. In fact, it's put right back at the center of medicine, with strong ethical rules to make sure the tech is always used for good. And that really leaves us with this final thought to ponder. The biggest promise of this whole revolution isn't just about faster data. It's the potential to free up the people in healthcare to be more human. So the question we all have to answer is, can we build a system that makes our hospitals not just smarter, but more human too? Thanks for joining this explainer.